A special Friday because today is Go Red for Women Friday, and we are here with our friends from the American Heart Association, Maranda Williams and Dr. Joshua Coney, a cardiologist with MUSC, to talk about this important day. Thank you both for being with us today.
Yes, thank you for having us.
Thank you.
And Maranda, let's start with you and your story. You're a healthy young lady and something happened surprising you with your own heart.
Yes, so actually I was only 40 years old at the time. I had gone through, I had COVID, and so a couple months later I just was not getting better, and so kept going back to the doctor. We couldn't figure out what was going on, and I think part of it, I didn't really know how to explain my symptoms all the time, but I just didn't feel good. And I remember one day literally holding myself up in my studio trying to get through my workday, and I knew something was wrong. And so I ended up having to be rushed to the hospital in an ambulance. It was just something that I would have never expected to happen to me at 40 years old.
And I'm glad you did not ignore the symptoms.
Absolutely.
And you were proactive in your own health. And
Sure.
Dr. Coney, let's talk about that. What symptoms as women should we be looking out for, and what are some of the things sometimes that people overlook and dismiss it as something else?
Well, of course, the typical symptoms of chest pain, chest pressure, palpitations or flutters inside of your chest, shortness of breath, dizziness, feeling like you're going to pass out but maybe not passing out is what's typical. In women, they often have, or very often have, atypical symptoms where you think that it's just maybe indigestion or a burning sensation in your chest, or maybe just a fleeting flutter that you really can't feel, but actually it's a cardiac event.
How do we know the difference between, okay, I'm having heartburn, I shouldn't have eaten those onion rings so late, and something is wrong with my heart and I should ask for help?
Yeah, it's really hard to tell the difference as a regular person who doesn't have any medical training.
Sure.
And so it's best to go to a doctor or to an urgent care to be seen by someone who has some type of training in cardiac conditions. They can do different type of updates or tests on you to make sure that you're in a good place and it's just indigestion or anxiety.
All right, let's talk about how to live heart healthy. You said you've made a lot of changes in your life since your event. What have you done?
So the biggest thing that I did to change just my lifestyle was change my diet. That was a huge thing for me. I've lost 52 pounds since since I've had my experience. And it was really just incorporating more healthy fruits and vegetables, lean meats, healthy fats. I have a son that's super athletic. He plays football. He's got basketball going on right now, so we're always on the go. So it's a challenge.
And those are all great things, but Dr. Coney, what do you tell your patients? What are the most important things? If we can make even just a couple of changes on her list, what are some of the most important things we should do?
Well, she did say a very few important things that I have, which is diet, exercise, good sleep, being stress-free if you can be, lowering your cholesterol, lowering your blood pressure, making sure that you're taking care of yourself.
And also talk about it, just like we're doing today.
Absolutely.
Talk about it and what
That's
it
right.
means to be heart healthy. Dr. Coney with MUSC and Maranda with the American Heart Association, thanks so much for being with us and raising awareness. And it is Go Red for Women Day. You can always reach out to the American Heart Association for more information on what they're doing in town.